Welcome to your pre-op teaching video for your upcoming rhinoplasty surgery. Now, well before your pre-op appointment, if you needed to get any clearance because of other medical problems, collect any lab work or an EKG, it's great to get that started before you come in for your pre-op. You're already watching your video, which is a good sign, and please review the paperwork that was also provided by our office. 2 weeks prior to surgery, it's important to stop blood thinners and herbal supplements. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oil, and vitamin E. If you drink more than a drink a day, it's great to reduce your alcohol use, and we always encourage everyone to stop smoking or vaping several weeks before your surgery. Review your teaching material and create a question list so when you come in for your pre-op appointment, we're specifically addressing what you don't quite understand yet or any specific questions that you might have. Now, waxing of your nasal hairs sounds painful and scary, but it really isn't. This is optional, but we highly recommend that somebody do this 1 to 4 days prior to their surgery. The esthetician will place a little wax up your nose on a stick and then yank it, and all the hairs come out at once. It actually barely hurts at all. It's very comfortable. Be sure to have them look inside to make sure they got all the hair and maybe do a second pull before you leave. These are a list of good over-the-counter medications to have around for any upcoming surgery. Tylenol, which we'll use for pain, Dramamine or Bonine, which are over-the-counter anti-nausea medications commonly used for motion sickness, an antacid like Tums or Pepcid, and some antihistamines in case you have any allergic reactions, including Zyrtec or Claritin and Benadryl. Other things that are great to have for rhinoplasty surgery include a humidifier, because when you're stuffed up with your splints in your nose, you do a lot of mouth breathing, and this can keep you much more comfortable if you keep it by your bed when you're sleeping. A nice collection of small gauze pads, some paper tape, something that you can use for cold compresses in the eyes. This could be something like the little gel packs that go in the freezer, or something as simple as Ziploc baggies with frozen peas that you can just keep refreezing in your freezer. If you have a way of elevating your head with either a wedge or extra pillows, that can be very helpful. Some saline nasal spray. The most common brand is Ocean nasal spray. The nasal irrigation system like Neilmed or Neti Pot, which are also commonly used by people just to keep their nasal airways clean, and this is something you'll use a few weeks after surgery. Some Aquaphor, which is just like Vaseline, and if you're having a graft taken from your ear, a travel pillow that is that C shape is also something great to have around. Now, Arnica Forte will be given to you at your pre-op appointment. This is a homeopathic medication that we use to speed healing. It contains pineapple and papaya and just tiny traces of wheat. So if you have any food allergies to these ingredients, you'll want to skip this. This is something we have patients start the night before surgery, and they continue it twice a day until it's gone. It does help to reduce bruising and swelling, and you can also buy these separately. Arnica, which is the Mexican medicinal plant, and bromelain, which is where the pineapple and papaya is, at a health food store if you want to continue taking it after this bottle is gone or separate out one of the allergic ingredients. We'll also provide you with what's called a soft pulse, and this is a little electromagnetic generator that we have patients wear around their face 24/7 until the battery dies, which is about 1 week to 10 days. There's one simple on and off button, and we rig this around your face so that that energy is helping to keep the swelling down in your nose. It reduces pain and swelling and can markedly increase your healing time. So we do recommend that you use this as much as possible until the battery dies. At your pre-op appointment, we will also give you your prescription medications. At this time, we print them and give them to you to take to the pharmacy. There may be a day coming soon that we can electronically send these, so our fingers are crossed. Most patients are going to get an antibiotic, an anti-inflammatory, something for pain, and something for nausea. IV antibiotics are started at the time of surgery through your IV, and we will provide a prescription that you'll start once you're home. We like to continue antibiotics for about 1 week or until that splint inside is removed. Now, there are some articles coming out that are questioning whether antibiotics are necessary, so this may change in the future, but right now we are prescribing antibiotics, and the most common that we use are Keflex or cephalexin, doxycycline, or clindamycin, and our choices are based on a patient's drug allergies. We also use Tylenol for pain, and know that Tylenol comes in 2 strengths, a regular strength, which is 325 milligrams per pill, and an extra strength, which is 500 milligrams per pill. So for a normal adult, we recommend taking 1,000 milligrams 3 times a day for at least the first few days after surgery. We never want a patient to take more than 4,000 milligrams in a 24-hour period, and this is written on every Tylenol bottle. So we start with taking 2 extra strength the morning of surgery with a tiny sip of water before you leave to the hospital, and you'll continue to take this 3 times a day until a few days after surgery to help with pain. Celebrex is also another common anti-inflammatory that we recommend. The generic is celecoxib. So I like to describe this as a designer ibuprofen because each of these pills will last for 24 hours and it has significantly less bleeding than traditional ibuprofen or other nonsteroidals. The dose that we prescribe is based on age and kidney function. So if you're under 65 and you have relatively normal kidneys, we recommend starting this twice a day as needed, and you can certainly reduce it to once a day or stop it if you're not having any discomfort. Patients who are over 65, we don't recommend taking more than 1 a day, except for that very first day of surgery, because older people's kidneys can be a little more fragile. Again, we stop this when you don't need it anymore for pain, but you're really only going to be taking this once a day as needed. So this is another medication that we start on the morning of surgery before you leave your house. You'll take 2 pills with a tiny sip of water, and you'll resume taking this 12 hours after surgery if you're under 65, and the next day if you're over 65. For some patients, we may also recommend Valium or diazepam, and this is a muscle relaxant and anti-anxiety medication. If you remember the old Rolling Stones song, Mother's Little Helper, this is what they were singing about. Now, you can take one of these 5 milligram pills every 6 hours as needed, but it can be sedating, so if you're also taking a narcotic pain medication, you don't want to take too many sedating medications at the same time. So it's smart to stagger these to make sure you actually need to take both, but have an hour or 2 between taking any of the sedating medications. You also don't want to take this with any sleeping pills or other anti-anxiety medications that you may already be on, like Xanax or Ativan, because these are the same class of drug, and that would be way too much medication for you. We also don't recommend mixing any of our narcotics or sedating medications with THC. This is a medication that we don't refill because of the risk of addiction. Now, narcotic pain medication may be needed for the first day or 2. Oxycodone is the most common one that we prescribe, and this is the same painkiller that's found in Percocet, but this one that we're prescribing does not have the Tylenol in it, so that you can take the Tylenol in addition and only the oxycodone when you need it. This is generally prescribed as 1 every 4 hours as needed, but if you're having severe pain, you can take 2 of these at a time. We just don't recommend this for prolonged use. There may be some other options if oxycodone is not a good match for you. Ultram or Tramadol is a non-narcotic that's a little weaker, and Dilaudid is a much stronger medication, but so we don't typically need to use that with a rhinoplasty surgery. Some people also have had good results with Vicodin, which has been discontinued. It is now called Norco, and the only difference is this one does have the Tylenol in it. So if you requested Norco, you have to do the math and make sure that you are not taking too much Tylenol. Also of note, we can't refill any narcotic medications over the phone. You do need to have a physical prescription. At this time. So again, with a rhinoplasty surgery, it's rare that anyone would ever even probably go through the prescription that's provided. Now, the goal of narcotic pain medication is really determined by the patient, not their caretaker. We want to make sure that moderate or severe pain is decreased, but don't expect to be completely pain-free. That is absolutely not the goal. And don't take narcotic pain medications just to treat anxiety. There are a lot of side effects with narcotic pain medications, including nausea, so always make sure you have a little food in your stomach, oversedation, a decreased respiratory drive, itchiness, constipation, and addiction. We'll also provide you with some prescription strength anti-nausea medication, and Zofran ODT or ondansetron is what we use most commonly. The ODT stands for an oral dissolving tablet. So you just place this under your tongue and it will be absorbed. So that makes it better if you've been throwing up, if you have a question of whether or not this can be absorbed if you puke it up right after you take it, because that can be absorbed just across the mucous membranes. We're also going to place in most patients what's called a scopolamine patch at the hospital. And this looks like a little spot Band-Aid. It's used for motion sickness and it helps a lot with postoperative nausea, and it works for 3 days. Now, this also has some side effects, including a dry mouth, blurry vision or dilated pupils, urine retention, and can cause confusion in older patients. So for males and older patients, oftentimes will skip this because the risk of those side effects are a little too high. When you remove this, which we recommend doing once you're home, comfortable, not having nausea, so that could be by the next day or definitely by 3 days if you felt a little bit queasy. Be sure to wash the skin where the patch was on your skin with soap and water and your hands after handling it, and toss it somewhere where if you have pets, they can't get to it in a trash can. Because if they eat this, this could make them sick. Now, remember, we also recommended that you buy Dramamine or Bonine, which are over-the-counter pain or anti-nausea medications. And the good thing is if you're feeling really pukey, all of these medications can safely be taken together. So if one of them hasn't worked, you can always move on to the other. So the night before surgery, it's important for you to understand what are called NPO orders, and that means when's the last time it's safe for you to eat or drink anything. So for solid foods and full liquids, things like milk, orange juice, or a latte, we need your stomach empty of these by 8 hours prior to your surgery. We do recommend that you continue drinking clear liquids up until 4 hours prior to surgery. Clear liquids include water, Gatorade, apple juice, tea or black coffee, and even clear Jell-O that doesn't have fruit in it. We know that if you kind of carb load before surgery, and also if you are used to having caffeine, you get a little caffeine in your system, you'll wake up from surgery feeling significantly better. So maybe you might set your alarm clock for super early in the morning just to chug some of this stuff and then go back to bed. It's not a problem if you skip it, but it will make you feel much better on the day of surgery, and your anesthesiologist will probably also make these recommendations. The night before surgery, you can also start your Arnica Forte, which will help with that postoperative bruising and swelling. Review your arrival time, because sometimes that will change between your pre-op appointment and the day of surgery, and you would receive a phone call or a Clara message from our office or the hospital if this were to change. Review all of your instructions, and you may get another phone call the night before surgery from your anesthesiologist. It may be a blocked number, so just keep an ear out because they would love to catch you the night before if possible and review your medical history. On the morning of surgery, take a wonderful, long, and lovely shower because this is going to be the last one for a week. We don't want you to wear any face lotion or makeup. If you have longer hair, bring some ponytail holders and easy clothes that you don't have to pull over your head, like a zip-up hoodie or a button-up shirt. Take your pre-op medications before you leave for the hospital with a tiny sip of water. And while this may change for some patients, in general, it's going to be 1,000 milligrams of Tylenol, 2 of the Celebrex tablets, and 1 Dramamine or Meclizine. Now, some people are also on prescription medications, and most of these can be skipped the morning of surgery. So at your pre-op appointment, if there's some things that are important for you to get that day, we'll review it with you and make sure you know which of your regular medications you should take the morning of surgery. Once you're home, after having a general anesthetic, we do require that everyone have somebody with them the first night. Elevate the head of your bed, use cold compresses on your eyes for at least the first couple days after surgery, because you'll notice the swelling will probably get a little bit better, but the bruising will get a little bit worse after the first couple of days. Have that humidifier going by your bedside, and this gauze taped underneath the nose is what we refer to as a mustache dressing. Also, a bloody booger catcher is another accurate description. So you can expect to have a bloody runny nose for at least the first couple of days after surgery. So having this taped underneath there can catch that and make it feel like your nose is a little more protected. Now, some people may feel a little claustrophobic with this on, and you can stop this at any time if you want to. You get to make the decision of what's most comfortable for you. We're going to probably send you home with a little bag of goodies, which I call parting gifts. We'll use a little antibiotic ointment at the time of surgery, and I'll give you the rest of that tube. That's what this green striped tube is here, called bacitracin. We also use a little medication that's similar to Afrin at the beginning of your surgery, and there's usually most of the bottle left. So I send that home, not because you need to use it, but because I think I have some that's like 10 years old in my medicine cabinet, so it's something that we just don't want to waste. We also use an eye ointment called Gentile during your surgery, and this is just an eye lubricant. Again, you don't need to use this, but we don't want to throw it away. Sometimes people will get a foreign body or scratchy sensation of their eye after surgery, and this is something that can help keep that just moisturized. So with this little antibiotic ointment, you do have some sutures between your nostrils, and it's good to apply a little antibiotic ointment 2 to 3 times a day on those stitches. Now, we also recommended earlier that you might want to have Aquaphor around. Aquaphor is an ointment that can be switched after the first few days of using the antibiotic ointment, because sometimes that antibiotic ointment can get a little itchy or rashy on people's skin, and just keeping it moist with a little dot of Aquaphor on those stitches is fine too. Now, the first night, keep your diet pretty light. What I say is don't eat anything that you're not willing to throw up. So I would stay away from real spicy and flavorful foods and go for more of some light comfort foods like maybe noodles, toast, scrambled eggs, soup, things like that. You will be swallowing a little bit of blood down the back of your throat, and we make horrible vampires. If you swallow some blood, your body's reaction is to throw it up. So once that happens, you usually feel markedly better, but it's not uncommon for that to happen the first night after surgery. So just keep in mind what you put in your stomach. Also, we want to avoid any straining or exertion. If you have to sneeze, sneeze out of your mouth. Try not to stifle that sneeze, and try not to do any heavy lifting, keeping your head elevated. If you have to stoop to pick something up off the ground, do it more as a deep knee bend rather than dumping your head forward. If we needed to take some ear cartilage, I will sometimes place a dressing with a bunch of little fluffy gauzes around that ear, and you can take that off. If it falls off that day, it's fine, but definitely take it off by the next day. Typically, there's going to be an incision behind the ear, so kind of where your glasses go on the back, and I close that with a medical super glue called Dermabond, so it really requires no care. Your ear will be very bruised and discolored and have some swelling, but there shouldn't be an excessive bulge in the bowl of the ear. So if it looked like somebody has put like an overripe plum stuffed in your ear, that is definitely something that bled a little too much, and we would want to see a picture of that or see you. Now, ears hurt when we take the cartilage for even up to a few months afterwards. So if you do have a travel pillow, you can sleep on your side with your ear suspended in the hole of the travel pillow, and that can make things much more comfortable. These are pictures of the most common splints that we use. The tan one at the top is called a dorsal splint, and that usually comes off at 1 week. And these soft rubber silicone internal splints also come out at the same time. We will place these inside your nose, and you can see there's a little tube opening here that if it stays clean and open, you can actually breathe with these splints in, but the vast majority of people, they get clogged up with some bloody boogers, and it can be really difficult to breathe through these until we remove them. Now, it's okay for you to take a bath, but we don't want you to take a shower. We want that splint to stay dry. And even if you were to shower and not get your face wet, the steam that's generated in that shower can make that dorsal splint pop off and become loose, and that would result in much more swelling and a much slower healing process. Now, the day that you are coming back in for your follow-up appointment, again, that is typically 7 to 8 days after surgery. If you would like to take a shower right before that appointment, you will probably feel great, and sometimes we appreciate it too. But that way, if we know we're taking your splint off in just, an hour or two afterwards, it's okay if it gets wet the day you're coming in to have that removed. So what's concerning after a rhinoplasty surgery? Fevers of maybe over 100.8 or 101. Most of the time a fever is from not breathing deeply. It could also be potentially an infection from the IV site, but we do want to make sure that fevers don't get too high. So if you are having a fever over 100.8, why don't you give us a call so we can just run through a couple of symptoms and make sure that there doesn't seem to be anything else that's going wrong. Also, a rash is concerning. Now, I told you earlier that narcotics can cause some itching, but if you're getting a total body rash, we worry that it could be an allergic reaction to one of the medications that you're on. So we would need to talk to you or see you. We want you to stop all the medications and start taking the antihistamines like Zyrtec and Benadryl. Sometimes even though you've stopped everything, it can take a couple weeks for the rash to resolve, but we don't want you to keep taking a medication that could be causing that rash. Now, antibiotics are typically the most common source. It could also be from the Celebrex. That's another common reaction. And the most common is probably just a dump of histamine from the narcotic pain medication, which is not a true allergy, but can sort of mimic that. And when we've had patients see an allergist afterwards to try to figure out what caused their rash, we've been told that they see at least a few patients every day that just get a rash from one of the narcotics that passes with time, and it's not truly to one of the other medications. So that can always be tested out with a medical professional later. We also would not expect you to have chest pain or shortness of breath. You'll have a stuffy nose, and sometimes that can give anxiety, but breathing should be fine through your mouth. Also, if there is heavy or new bleeding, you should have that little bloody, runny nose for a few days, but if it started to gush blood running down your face, drip, 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 swallowing lots of blood, that could be from an arterial bleeder, and we would need to treat you for that as well. Normal things are pain. We break some bones, we stuff a bunch of stuff up your nose. So it's going to be a little uncomfortable. And most people sort of describe more of like a pressure headache kind of feeling. You also would likely have a sore throat for the first day after surgery. We are going to see some bloody drainage, like think of a bad cold with a bad runny nose that's blood tinged. That is totally normal. You're going to have swelling. You're going to have bruising. And again, that first night, it's not uncommon to have a little bit of vomiting. Now, most people are not taking their pain medication for very long or feel very bad after a rhinoplasty. So most patients can be driving within the first week for sure. Don't drive until you're off all of your sedating medications, including the narcotics and the Valium. Use good judgment because your reaction time may be a little slowed because your body's a little preoccupied with what's going on healing from surgery. At your first follow-up appointment, which is again typically 7 to 8 days after surgery, remember it's okay to shower right before this appointment, and we're going to remove the external and internal splints and the sutures. This is not wonderfully pleasant, but it's not that bad. It's really typically maybe a minute of some discomfort, and then you immediately feel much better. We will also discuss scar care, but this is not something that we want you to start until closer to about 2 weeks. Again, we don't want any heavy lifting or heavy nose blowing for at least a couple of weeks after surgery. You can use the saline nasal spray to kind of clean out your nose. And after about 2 weeks, a week or 2 weeks, it really is no set time. You can use the NeilMed nasal irrigation or a neti pot to get all those crusty, icky boogers out of your nose. Remember, there are a lot of sutures in your nose, so don't yank on anything that's stuck in there, but cleaning it regularly with distilled water and the little salt packets that come in here can definitely get your nose cleaned out a lot faster and keep it clean. It's great for your sinuses long term as well. So a great place to use this is actually to make the distilled water and the salt packet and take it in the shower with you, so you can do it while you're in the shower in case that water goes everywhere. We don't want the weight of glasses resting on your nose. We may say longer for some patients, but generally for 2 weeks, we don't want that weight on there. And exercise can stir up a lot of bleeding and swelling. So we want you to keep things super light for 2 to 4 weeks after surgery. If you play a contact sport or there's a risk of you getting bonked in the nose, we need protection to those healing bones for at least 6 weeks after surgery. The second follow-up timing can be really varied from patient to patient. We may want to see you 1 week later, or maybe even a few months after your surgery. There are little blue sutures that we put in, and we want to make sure that all of those blue sutures are out at that first appointment. So if you see any residual little blue suture, come back in and we can take that out, because sometimes it's under a little crust or scab or something like that and we miss it. Remember that it takes a super long time for swelling to go down after a rhinoplasty. It can be even as long as 2 years for patients with really thick skin, but don't expect to appreciate your final result for up to 12 to 18 months. Now, some people are really stuffy afterwards, and we may recommend something like these soft silicone nasal dilators that you can slip in your nose when you're sleeping at night or when you're just working at your computer and nobody can see you and wonder why you have stuff stuck up your nose. But sometimes this can help during the healing phase for patients when they feel a little too stuffy. Now you are prepared. You have planned ahead by watching this video, and you can make adjustments in your life. Make sure you bring questions to your pre-op appointment. If you have people that I anticipate taking care of you after surgery, please share this video with them as well, because they need to know what your instructions are. It's very nerve-wracking for them, in addition to you getting ready or healing from surgery. Take the time you need to heal. Don't try to do too much too fast, and by all means, please follow your instructions.